Welcome to another video discussing different mental disorders. Today we will discuss one of the most common disorders people have, which is ADHD. ADHD stands for Attention Deficit Hyperactive Disorder. This means the people with this disorder have issues with their attention span and their hyperactivity. You must have definitely heard someone being a little ADHD cause they just keep forgetting if they locked their door or not. Well, there could be a chance you have ADHD, but until you're not diagnosed, assuming or self-diagnosing is not appropriate. In this world, we have about 5 to 7% of children and around 2 to 5% of adults worldwide that have ADHD. Yet these statistics are just of the people that are diagnosed. Imagine the individuals we might have that haven't diagnosed themselves. Anyways, though it is not common knowledge, ADHD actually has 3 types. As you know, it is a disorder for attention span and hyperactivity. Well, that's the first type, combined presentation. The second type is predominantly inattentive. It's when one has higher attention issues and lower hyperactivity issues, and third being predominantly hyperactive impulsive, the other way around, where one has higher hyperactivity issues and lower attention issues. Let's look at a scenario with a trio, one with each type. Lucas here has ADHD-C, Chris with ADHD-I, and Raven with ADHD-HI. All 3 of them study in the same class and have the following remarks from their teacher. Chris often forgets about his homework, forgets his assignment deadlines, and sometimes zones out in class when the teacher explains important information, causing him to miss out on key information. On the other hand, Raven often interrupts the class without raising his hand. He fidgets often with his classmates' belongings or his own, and sometimes even has left his seat without permission. Whereas Lucas is sort of the combination of both Raven and Chris, where they often forget their homework, get anxious, and start running away from class. The reason for this distinction is to notice some things that might differ between them. You see, though Chris is forgetful, he doesn't really fidget or move around, rather stays quiet and still. However, Raven tends to remember all his homework, but is extremely mischievous and fidgety, often disrupting the class. Finally, Lucas, who lets his emotions get the best of him and is anxious often. Obviously these examples are overly exaggerated, but hopefully you get a general idea of what this all means. ADHD is one of the many disorders that rely its intensity on a spectrum. Some people have ADHD and are on the lower spectrum, where it is easier for them to manage their symptoms, while some are on the higher spectrum, making it even more difficult for them to manage it. ADHD also comes with impulsive thoughts and actions along with some intrusive ones too. However, intrusivity is not always the case for every ADHD person. As explained in the OCD discussion, it is different from intrusive thoughts. Few individuals have such higher impulsivity in them. They often act out without meaning to, or like Lucas, run away from places that causes their anxiety to get the best of them, also known as their intrusive thoughts. A common issue most ADHD individuals have is their loud brain. To simply explain this, imagine a train of thought. Usually when you have those, you have a voice in your head telling itself what it is thinking. Well, ADHD people have probably thousands or millions of those trains, most of them with actual good and smart thoughts, but there is no point of how good or bad the thought is, since all these trains run at the same time, making it difficult for them to focus on themselves, other people, or their surroundings. Hence, the attention issue. ADHD, like many other disorders, is also very exhausting for one to have, especially when it usually gets paired with anxiety, depression, learning disorder, and more. But there are many treatments that help such patients to manage their symptoms. Unfortunately, disorders like ADHD aren't curable, so one spends their therapy session finding out how best they can live in a world that is seen differently from their lens. Treatments can include medications, cognitive behavioral therapy, CBT, 504 plan in schools, physical activity and exercise programs, apps for task and time management, coaching by professionals specializing in ADHD, and then the other treatments for co-occurring conditions like anxiety, depression, etc. As we have said before, disorders always will have a general view or treatments that are known, but that does not mean it works for every single person. It will all depend on each person's case, which is why therapists are there to help you figure out what works best for you. If you're an ADHD individual, let us know your unique way of managing your symptoms, and for those who aren't, tell us a myth you heard about ADHD. Thank you so much for watching. Follow us on our socials to keep up with other events through OK Minds and more such discussions. See you next time.